I'm trying to do is protect vulnerable men and make sure that they understand the consequences for their actions. Policymaking men on the right have taken great care to ensure that women are protected, and I thought it only fair that we protect the greatest gender, men, in this country.
Last night on this show, Ohio State Senator Nina Turner discussed a bill she introduced requiring men to get psychological testing before receiving erectile dysfunction drugs. The purpose of the bill was to point out the inequality and sexism of more than 1,100 laws in the United States attacking women's health and reproductive rights. And Senator Turner is not the only state lawmaker using this strategy. Similar bills have been introduced in at least 8 other states. In Virginia, State Senator Janet Howell introduced an amendment to the controversial ultrasound bill requiring men to undergo a rectal exam and cardiac stress test before getting erectile dysfunction drugs. In Illinois, State Representative Kelly Cassidy suggested men should have to watch a video showing the treatment for persistent erections before being allowed to pop a Viagra pill. In Georgia, a bill was introduced outlawing most vasectomies, saying thousands of children are being deprived of birth because of them. And I have to tell you tonight, 30 years in the business, I didn't think I'd ever read anything like this, but this is what the news is all about in America in 2012. I find it amazing. Let's turn to the authors of these 2 bills. I've mentioned Illinois State Representative Kelly Cassidy with us tonight, and also Virginia State Senator Janet Howell. Senator Howell, you first. I appreciate both of you being with us tonight on this subject. I can't believe that this is what it's all about in America right now for women's health care. Senator Howell, what inspired you to introduce this legislation, a rectal exam and cardiac stress test?
Well, I was just so angry about the ultrasound bill that was in this Virginia Senate. It was requiring women to have transvaginal probes before they could have an abortion. These totally medically unnecessary, costly, demeaning procedure. So I thought, well, let's just have a little gender equity, and let's have the men have digital rectal exams.
How do you think this is going to be received?
Actually, it's had a great reception. It's gone viral. It led to all sorts of jokes about Virginia and what the Republicans were trying to do to women. So the bill, even though we didn't have the votes to defeat the bill in the first place, the governor was forced to modify the bill. It has passed, but it no longer requires transvaginal probes. It's still a terrible bill, but it's not as bad as it would have been.
Representative Cassidy, what reaction have you gotten from your bill in Illinois? Video of persistent erection treatment, and I understand it shows exactly what men are going to go through if they have an erection more than 4 hours. What's the purpose here?
Well, you know, if, as is presupposed in the Ultrasound Opportunity Act, which is one of the better titles I've heard, you know, the premise of that bill is that women are fundamentally incapable of making that decision with their doctor without help from their legislators. I believe that we need to ensure that men have that same opportunity to view the potential side effects of erectile dysfunction treatment. If we don't believe women can make these decisions, then we must not believe that men can either.
And there are some who see your legislation as ridiculous, while legislation about women's reproductive rights is so widespread. I mean, do you think that this is going to be a real attention getter, and maybe this will back off the right wing and their social agenda?
Well, you know, earlier in the show, there was discussion of, you know, 1992 and when women were just so angered and so outraged, and how women came out in such enormous numbers, and that's what I'm seeing here. It is stunning to me that we're still having this conversation, that we haven't established that women and doctors can do this on their own. And so I think whether it has an impact on this bill or other bills in the country is less clear than the fact that it will have an impact on how women vote.
And I want to get both of your take on this. Senator Howell, is this a turning point for women? on this issue?
Oh, I definitely think it is the forces against women's reproductive health have overreached, and people are reacting. But I've been interested in the reaction I've gotten from mine, which was, I believe, the first of this kind of an amendment. I've received as many emails from men who are outraged by what's being done to women as I have from women.
How about you, Kelly? Is this a big turning point socially in America right now that will have a big political impact?
I certainly hope so. What is frustrating, though, is that we keep winning this battle over and over again. We keep having to refight it. You know, I began working in Chicago a little over 20 years ago, and, you know, we had the Year of the Woman in 1992, and I was working on reproductive rights then. I've been working on reproductive rights and women's equality, I think, for as long as I can remember. I'm sure we could find some grade school friends who would tell me, you know, tell stories of me standing up to them then. And we keep having to refight the same battles, and that's the most frustrating. But, yeah, the response has been really overwhelmingly positive and pretty well balanced by gender. I mean, I'm getting reactions from all over the state, all over the country, from folks who are frustrated as well, and glad to see folks standing up and fighting back.
Illinois State Representative Kelly Cassidy and Virginia State Senator Janet Howell, I appreciate your time tonight. Thanks so much.